Welcome to this open web meeting offered by the FRESH Partnership, looking at a continuing series of topics on health education, health and life skills education. I'm very pleased to be discussing this topic of the learning time available in health and life skills education with Susan Telljohann, who is a professor emeritus at the University of Toledo. I'll be going through a few slides to introduce the work of the FRESH working group, and then Susan will take us through the data that's available from the United States on the amount of time that is available and is being used in health and life skills education. I'm very pleased to see that this has been a recording or part of a process of several small web meetings looking at different topics like this. And this recording and the slides and materials that are available from the discussions we're having will be used in a report from the FRESH working group that will eventually go to the UN agencies who are responsible for monitoring the student achievement as part of the education goal of the UN Sustainable Development Goals. There is a target there, 4.7 of Goal 4, which is education, which is looking at the quality of education. And the process is intended to be able to provide a realistic look at what can be learned in health and personal and social development education, and what time is realistically available and what are the demands being placed on that time. So that's really looking at this slide. The purpose of this web discussion is to look at instructional time. A little stop about the terms health and personal and social development. It is including both health education as well as what other folks call personal and social development education, and it's quite a broad scope of learning that can be looked at as well. As noted earlier, the FRESH working group, the FRESH group consortium or partnership is composed of several UN agencies, several global organizations, and several donor organizations from around the world. And we've been working on this task for a number of months now. We're not going to be able to solve the issues that we're identifying, but we are hoping that the suggestions or hypotheses that are developed in the FRESH working group can be taken up by a parallel research network, which is being led by the World Education Research Association, and in terms of teacher development and development of other professionals in health and personal social development, the newly formed global network of faculties of education, the deans of those faculties, will be looking at workforce development issues. And as noted again, that the target 4.7 in the UN goals is the end point of our conversations. We're hoping to provide a realistic way for UN agencies to monitor what is being learned as part of a high quality education provided to children. There are a number of paradigms, as we've called them, that relate to health and personal and social development education. Health literacy, or literacy in health and safety, is one. And you can see that it includes knowledge and skills and media literacy and critical thinking, and it's applied to a number of issues, number of topics that are listed at the bottom of that first point. They're looking at it needs to be applied to issues of the day that are relevant to the context that's delivering it. So it's a very broad scope of health literacy, or literacy in health and safety, but it's an important, one of the most important paradigms. The second area is also often used as a framework or a paradigm, life skills, which we've defined as including social skills and coping skills and conflict resolution skills and social emotional intelligence and so on. And again, that's a very broad concept, going from knowledge to skills. And the last point is social inclusion, which are really values that we're hoping that young people can learn in school and through the health and personal social development strand of schooling. And that's looking at human rights and global citizenship and peace education and a variety of other values and beliefs that need to be addressed by young people. As everyone knows, the curricula in all schools, in all countries, is very crowded. This slide really looks at the many demands that are placed on the timetable, the formal timetable. and the learning that's required in those different domains. It's very challenging for timetablers and for schools to be able to address all of those areas of learning, and so that's the challenge that we're also trying to keep in the background. And another aspect which is made evident by this graphic of our work, we have placed the children at the center, the whole child at the center. Within that small circle, you can see the various subject areas that are traditionally part of the core curriculum of schools, and you have social studies and science and math and health education and so on, home economics, all within that subject areas. We've used the UN goals. There are 17 goals as a kind of a reminding us of the various aspects of health and human development that need to be considered. Health and education, you can see on the right-hand side, 3 and 4, gender issues, sanitation issues as I'm walking around the table, around the circle. Over on the left-hand side, you see consumption and production, which is obviously related to home economics and so on. The UN goals are very broad and need to be considered as we try to develop curricula as well. In the far outer circle, we've looked not only at we've gone outside the curriculum to look at the kinds of learning that can occur outside of the classroom, be they in co-curricular activities, implicitly through the things that go on in school climate or the social environment of the school, in extracurricular activities. And if you go down near the bottom, you can look at community-based learning or web-based learning, and so on. There's a lot of good work that's been done over on the right-hand side in school routines, where children in low-resource countries are taught how to brush their teeth and wash their hands before meals, and the schools actually provide those facilities so they can do that in school and learn how to do that properly. And those school routines are an important part of the learning. So the outer circle is what some researchers call extended educational learning opportunities that go beyond the classroom. And so that's part of our calculation as well. Today we'll be looking more at the classroom instruction, but there is also an equally challenging task of trying to coordinate those non-classroom activities that can be used to learn about health and personal and social development and education. So that's the introduction to the work group. I'm going to ask Susan to walk through her slides and to be able to tell us about the health education situation in the United States. And Susan, if you click on that little button, you should be able to take control of the slides.
You're about to stop. Okay. Hopefully I'll be able to. Let's see here. Okay. All right. That's good. Well, first of all, thanks, Doug, so much for inviting me to come here today and talk about this. I don't know if I'm going to answer any questions or if I'm going to actually create more questions, but we'll see what happens. So when Doug asked me to take a look at this, there were 2 places that I looked at to try to come up with some type of response around the required amount of time in health education in the United States. And the 2 areas that I looked at, one, it was the School Health Policies and Practice Study, better known as SHPS. And SHPS has been taking place for quite some time now, although the amount of resources dedicated to SHPS study now has been decreasing over the past decade. But basically what the SHPS study's done, and this takes place through the Centers for Disease Control and Prevention, it's a national survey that tries to assess the school health policies and practices at both the state, district, school, and classroom levels. And one of the areas that is examined is health education. There's certainly other areas, physical education, nutrition, counseling, but what we're going to look at today are the results of that study in health education. And then the other area that I looked at was an organization called the National Association of State Boards of Education. They received some funding from the Centers for Disease Control and Prevention to take a look at what are the policies at the state level around health issues. And one of the areas they looked at was health education as well. So we'll take a look at some of the results of those 2 different pieces of data that I looked at. So when we take a look at SHIPs, one of the things I wanted to point out is that we have seen diminishing resources dedicated to the SHIP study. So the results that we have in 2016 are really not that great compared to what we had in 1994. So in 1994, 2000, 2006, money was dedicated to take a look at what was happening in kind of this whole coordinated school health area at the state, district, school, and classroom level. In 2012, they only looked at the state and district. In 2014, they looked at school and classroom. And in 2016, they were only able to survey at the district level. And just please keep in mind that this is a random sample and representative of all 50 states, but only a few districts in all 50 states. So it's not something that, we can say this is something that we know for sure. This is, totally accurate in terms of what's going on in every single school district, but it does give us a little bit of data to look at. This next one basically looks at, and the question was asked, the percentage of districts, so this is a district question asked in 2012, because that's the last time they did the district level, that it adopted a policy that schools will teach specific health topics by school level. And so, again, this is the percentage of schools that say, yes, we are required to teach different health topics. So that doesn't give us the amount of time. It just says that we have some kind of policy that this needs to be taught. So it could be that, a district only chooses to spend 2 minutes on something or 5 minutes on something, and they can say, yes, we've done it. So this isn't very helpful to us in terms of the amount of time. It just basically tells us that there is some type of policy that's written. This one is probably a little bit more helpful because this tells us the number of hours. Now, this is by school level. So different schools within states were asked to complete this. So again, there's a lot of local level control in the United States. And so these were the schools that were selected, and these were the answers that they gave. So on this particular chart, if you take a look, for example, at high school, which I think probably they do a fairly decent job on this. If you add up all of the number of number of hours that take place at the high school level, that adds up to 56.8 hours of health education that are required at the high school level. So that's grade 9 through 12. At the middle school, and that equals up to about a semester, maybe a little bit less than a semester. So a semester in the United States would be 18 weeks, and that would equal out to about 75 hours of health instruction. In the middle school, if you add that middle column up, it equals out to 46.6 hours. So if you take a look at that, 1/4 or 9 weeks of health education would be about 37.5 hours. So that might equal about a quarter or 9 weeks of health education. That would be in grades like 6 to 8. At the elementary level, if you add those hours up, that adds up to about 35 hours. So that's saying in all of elementary, K to 5, you're looking at 35 hours of health instruction, which would be about 6 hours per year of health instruction. So that's one data point that we have. That was a school level saying that that's what takes place that are required. So just try to keep that in mind as we go to the next slide. So the next slide, and I don't think this is a very accurate slide because this talks about the duration of required instruction on health topics. Again, when we take a look at this, the problem with this slide, it asks for each grade level. And through my experience in doing professional development around the country, there are very, very, very few school districts that have health education taking place at the 11th and 12th grade level. But yet you can see that they say number of weeks that they teach health education, 20 weeks, for example, 11th grade, for 3.5 days a week, and a minimum number of 56 minutes during those class periods. So this to me is not a very, very accurate table. I think the previous table, if I were, making my best guess, that would probably be more accurate in terms of the amount of health education taking place. So this one again, I think is a little bit misleading, but I did want to include it because it is included in the SHIP's data. Now, one other data point that I think is interesting, and I sent this to Doug, and there's a handout, about a 3-page handout, that lists every state in the United States and the National Association of State School Boards of Education. They actually, they created this database, and they look at every state to find out what are the mandates in health education and how much time is actually required. So I only put the first 6 states there, but there is a handout that has all of them. And so this would be something I think to keep in mind as well. I can give you kind of an overall summary of this. And again, I'll look at the next slide because this is going to be my best guess for this. That when you look at this, the majority of states, certainly not all states, require about a half a credit, which equals 1 semester or 18 weeks of health education. And that would be a dedicated separate health course taught by a health education teacher. Some states, and I wouldn't say the majority of states, require health education at the middle school level, a dedicated health education class, anywhere between 9 weeks and 18 weeks, so a quarter to a semester. At the elementary level, most elementary teachers teach some health education, but there really isn't anything that's consistent. And at the state level, in terms of requirements, some states require certain health topics to be taught, but no minimum minutes or hours associated with that. So those are my best guesses in terms of data that we actually have and just kind of my experience of doing professional development in a variety of states. But certainly I would say there's a lack of consistency between states and certainly no guidance at the federal level in terms of health education. So it's basically a hodgepodge about what takes place. So I'll stop there, Doug, and certainly feel free to ask questions, or we can have a conversation about anything that's on these slides.
Yeah, let's do that, and thank you for the finding out this data. And my primary concern right now is to figure out the number of hours that are available in a high-resource country like the United States or other countries in Western Europe or in Canada or wherever. And so when you look at the majority, the half credit of 1 semester of 18 weeks, how many hours of instruction do you think that would be?
Yeah, so that would probably equal out to about 75 hours. Because you're looking at 18 weeks, and I would say the average class period would be about 50 minutes.
And then is that over a couple of grade levels?
No, that would be over 1 grade level.
Okay, all right. And then so that 9 weeks of 18, the middle bullet there, that would be for middle school grades. That would be how much time again?
Okay, so that would be anywhere from 37 and a half hours if they had a quarter-long class, which would be 9 weeks, to 75 hours. Now, okay. I will say that there's much more variety that takes place at the middle school level. That I know there's many districts that would have 9 weeks at, let's say, 7th grade and 9 weeks at 8th grade, or they might just have health education during one time during middle school, and that could range from a quarter to a semester. So that's why I said I would say there's much more variation that takes place at the middle school level around health education. And again, keep in mind, I wouldn't say the majority of states have health education, dedicated health education at the middle school. I would say that there are some states that require it, but certainly not the majority.
Okay, so in looking at that, how the time is available, and we've talked about this before, if you were planning a health education curriculum with a state or a country, and working with those kinds of numbers of hours, and the going back to the previous slide, looking at the number of topics that might need to be covered, what would you think about dividing up the time? Would you would you think about trying to cover all those topics, or would you try to focus in on 3 or 4 or 5 topics?
So when I provide guidance to school districts and we work on a scope and sequence, we really look at what is reasonable and how can you make an impact on certain behaviors. So for example, I've got this slide up right now that has a variety of health content areas. And if I were working, for example, with a school district that had high school health education for a full semester, 18 weeks, and let's say at middle school they only had health education for 9 weeks. So let's start with the 9 weeks first. I would probably encourage them to probably not choose more than 4 to 5, 5 being the absolute maximum, 4 content areas that they wanted to try to impact, and to make sure that what they were doing is teaching those content areas very well with a combination of functional need-to-know knowledge along with a variety of skills that might be aligned with those particular content areas. So let's say, for example, alcohol and other drug use prevention. That's a very big topic because we have alcohol. We might include, depending if we want to include tobacco with that, the whole opioid issue that we're facing here in the United States. So there's a lot of topic areas within that there's a good functional information that's needed to be taught. But then what skills go along with that? Probably some refusal skills need to be included with that. Perhaps advocacy skills might be included with that, and perhaps the whole analyzing influences. So those might be 3 skills that are aligned with that particular content area. Well, when you teach all the functional knowledge and the skills, that's probably going to take about 2 to 2.5 weeks to be able to do that and do that well. And so I always, when I work with school districts, I ask them to think about what are your most pressing issues based on the data that you have available. So some school districts will have county data, they might have local data, or they might only have state data that they can look at for that particular age range that they're teaching, and then decide on the most pressing issues. And then we would do that the same thing with high school. Okay, do some of these content areas need to be reinforced at the high school level? And if so, which ones? And again, thinking about maybe 2 weeks, if you have health education every day for a 50-minute class period, 2 to 2.5 weeks per content area. That's usually about the range that we talk about.
Okay, and that coincides, that idea of choosing 4 or 5 topics coincides with the FRESH guidance. The FRESH partners have put out a guideline about school health promotion generally, and they suggest that in the very beginning that priority issues need to be identified through database sources, and then right. Those choices need to be reflected both in the curriculum as well as any support services that are provided through the school. So that I think resonates with that advice of focusing in at least at now those 4 or 5 topics can change by grade level. Going to the skills issue, is there a way of making sure as the various topics are developed, is there a generic set of skills or a common set of skills that can be kind of a part of the scope and sequence of a curriculum? And what's your experience with that?
Right. So in the United States, we have 8 health education standards. Our first standard is a content standard that basically addresses the functional health information that kids need to adopt certain healthy behaviors. But then our standards 2 through 8 are all skills. So our skills are analyzing influences, accessing valid, reliable information, products and services, goal setting, decision making, communication. We have kind of a self-management skill, and then advocacy. And so when I'm working with districts, I ask them to make sure within each one of those content areas they are teaching at least 2 or 3 skills to help students adopt the healthy behaviors within those content areas. And so one of the things that we don't know right now are the skills that really should be taught with each content area. we have some pretty good ideas through some of the single subject, single grade level curricula that have been evaluated. So for example, in the area of sexual health, you're always going to see communication skills, negotiation, refusal skills. You're probably going to see accessing valid information, products, and services within that content area. You might see advocacy within that content area. But if I look at nutrition and dietary behaviors, and we're trying to get students to eat healthier, they're almost always going to use goal setting as a skill that would be included in that content area. Because we all can improve our eating patterns. So goal setting might be one, but accessing valid and reliable information would probably be another one in terms of learning how to read food labels, knowing where to go get accurate information about nutrition. So we always tell districts, at least I do when I'm working with them, that they really should have 2 to 3 skills within each content area that they're teaching. That information, by the way, that guidance comes from our tool called the Health Education Curriculum Analysis Tool, the HECAT, where when you look at that tool, it provides guidance about what should be in a curriculum related to skill and skill development. So that would be a tool to look at as well.
Okay, and thank you. That's we'll be putting the HECAT tool as well as similar resources from different parts of the world onto the session description in the webinar page of the Fresh Partners website, as will the document referred to earlier, the analysis of the U.S. state curriculum documents. So they'll be convenient and handy if people just go back to that page to take a look at it. So really, if we're trying to figure out what amount of time is available in a high resource country, you're starting to get us towards that answer, even though we probably need to verify that data in some kind of survey. And so actually, as we've talked before, the International School Health Network with a couple of partners will be doing a fact-finding survey of all countries and states to try to determine if they have a core curriculum in health and personal and social development education, and is it required or recommended as a curriculum, and then also the amount of time that they're estimating is actually being delivered by the 3, sort of primary school and middle high school and senior high school. So there'd be some basic data based on response of officials who are at a government level, which is not necessarily the accurate picture as we go down go down into the system. And maybe that's another facet, maybe just to pull out so we can talk about a little bit. In the United States, you noted that the system is decentralized and that local school districts and local schools make decisions. Do you think these numbers bear out if you went down to ask samples of teachers? Would these numbers bear out as to the amount of time that's actually being delivered?
I think the slide that I have on right now, where it talks about how much high school, I think that would probably be fairly accurate. I actually think those numbers are fairly accurate at the school level. Because they, when I averaged those out, when I said about 5 hours of health instruction at the elementary level per grade level, and I would say that that's probably, unfortunately, fairly accurate. At middle school, having that anywhere between a quarter and a semester, 9 weeks to 18 weeks, I'd say that's pretty accurate. And the same with the 18 weeks at the high school level. That's probably pretty accurate data. What I think is not accurate data is the previous slide that talks about, at 12th grade, 11th grade, at each of those grade levels, because that's way more time, at least in and again, I've worked with some school districts that I think have really good health education. They wouldn't come close to meeting that information that was printed on the previous slide, but they would come very close to meeting what's on this slide. I think the problem when you ask, I think SHIPS has faced this when SHIPS has collected their data, even at the state level, is that districts and states don't want to look bad. And
Yeah.
so a lot of times they overestimate in terms of what they're actually doing, in terms of reality. One of the things that was so good about the original SHIP study was, and that, clear back in the 90s, was they actually sent people out to interview teachers. And so you got a more accurate picture about what was taking place, but that data is so old now that I wouldn't even want to look at that because there's been so many changes that have taken place in the United States. So it's unfortunate that CDC doesn't have the funding that they used to have to be able to do that, because I think that was probably our most accurate data, because it was verifiable even at that school teacher level, at going in and observing and asking teachers face to face what was actually going on.
Yeah, no, I agree with that. We did a similar study to SHIPS when I was working in Canada with the Council of Ministers of Education, and we didn't go into schools, but we did do the survey in an interview as the respondent went through the questions. And so if any question of interpretation of what was meant by the question came up, then the person doing the interview could make sure that the same interpretation is used, and it is challenging to be able to make sure that the same sense of the question is being answered in each case. It's
right.
So it's useful. Okay, this is very helpful. It's giving us as we've talked about before, getting towards sort of a ballpark of what is the time available in a high resource country, and I have been taking a peek at several curriculum documents from non-U.S. sources, and I think they reflect the data that you found in the National School Boards Association database, that several jurisdictions do require time in their curriculum documents. Whether or not that follows another question, but and I think the U.S. is the only one that has a SHIP study like this that actually asks that the number of hours or that are actually being delivered. But it is going to be able to, we are through the research network that is being led by Dan Leitch from Simon Fraser University and colleagues through the World Education Research Association. We will be able to do content analysis of curriculum documents, and this is going to be one of the important questions that we're going to be following up on. I did, as we noted in a private conversation, I was on a webinar, one of the series earlier this week, and we had a presentation from Finland, and I learned that they have a mandatory health education course that is stipulated in law, apparently, at 38 hours per year. So that's probably similar. I think it's in the same ballpark that we're talking about, although they are talking more at the junior high school level than senior high school level. So the number of hours seems to be correlating with what you've drawn out of this data for us. So I think that might be, and if we do a calculation of, I did something just on a back of a piece of paper, really, is if you have 2 classes of 45 minutes a week, or if you have 3 classes of half hour a week, that's 150 minutes a week. And if you go multiply that by about 40 weeks, you end up with about 50 hours of instruction. You're probably better able to answer this question, but the last time I saw research that looked at the impact of health education generally on behavior was back a study done in 1985, which is actually one of the first things I ran into. It's cited in the session description, the School Health and Education Evaluation Study done in the U.S., which was a large-scale study, and that found that if there was about 50 hours of instruction provided, there seemed to be some behavioral change. Are you familiar with that study, and is there any other study that you're aware of that's more recent than that one?
Yeah, so that study certainly is a classic in the United States. It's a study that I had to learn about when I was a doctoral student. So yes, I'm familiar with it, but we have not been able to replicate that, unfortunately. So what we do have, the only thing that we have at this point, we don't have anything on comprehensive health education. and the impact on behavior. We have these, single subject, single grade level curricula that range anywhere usually from probably 10 to 20 hours, but focusing on a single content area. And those things, those curricula in terms of showing impact on behavior. Now, one of the things, and this is in the HECAT document as well, one of the things that CDC did was a synthesis of kind of all of those studies, and a lot of them started out in alcohol, tobacco, and other drugs, and went into sexual health, and we have some in violence. But those are probably the three big topic areas, I would say, where there's kind of specific curricula for specific populations or grade levels. And again, they range anywhere from probably 10 to 20 lessons. And if they have, and all of those have been studied with a control and experimental group and looked out over time, anywhere from 12 months to 18 months to 24 months after the curriculum was delivered. And CDC did a synthesis of the literature around those effective curricula to find out what they had in common. And there's about 15 of those different characteristics that they had in common. So that's in the HECAT as well. That to me is probably one of the most important pieces of information that CDC has ever developed, because it provides guidance to health teachers about what they should be doing in their classroom to impact the behavior of kids. So it doesn't speak to time, but it does speak to quality health education and what should be taking place in a classroom. So that, to me, when I do professional development, I focus a lot on that, because I think it provides guidance around the types of things that should be taking place in a classroom.
Okay, and I, just to maybe continue that discussion, we'll be dealing with it later on in the Fresh Working Group as well. Is there is a debate about whether health education can do more. There is that one study, to my knowledge, about the cumulative impact of a number of hours of instruction on behaviors, but many of those single topic studies and in single instructional units do end up showing that there's knowledge change and maybe some changes in attitudes, but it's very difficult to measure changes in behavior.
Oh, no, I will tell you this, Doug. Those studies, and this would be a good one to take a look at, CDC only included studies that showed impact on behavior.
Okay.
And so there's probably, I'm going to say, I'm guessing at this now, probably 25 to 30 studies that have been done that have shown an impact on behavior on those single subject, single grade level curricula. And if you look at the HECAT, and I think it's chapter 1, where it lists the characteristics of effective health curricula. Mm-hmm. There is a reference list there that kind of has a variety of articles, research articles that look at those different curricula. But that's the best guidance that we have. I mean, but again, you're looking at, maybe 3 or 4 behaviors within a specific content area they're trying to impact, and that taking anywhere from 10 to probably 20 lessons.
Okay, thank you. That's a bit of a clarification too, because one of the cautions that I think we're going to end up making as a Fresh Working Group is that very often health education, or even school health promotion generally, is it's lined up with long-term behavioral change. That over the lifetime, by having health education in elementary school or secondary school, we're going to have huge changes in behaviors, in terms of over the lifetime. And in my view, that's not realistic. We can look at the impact of schooling over the short term, a couple of years after the student has gone through the experience of schooling and of education, but I really worry about attributing long-term behavioral impacts unless it's been actually studied through longitudinal studies.
Right, and when CDC included, I think, the criteria that allowed them to say that program was effective, they had to show change in behavior for at least 12 months.
Yeah.
Most of the studies look at anywhere between 12 months and 24 months, but that's it. And so, what we don't know, and I talked to the folks at CDC about this for quite some time, that unless we invest in having a longitudinal study that looks at kids that have health education from kindergarten all the way through 12th grade and then beyond, but you're looking at a multi-million-dollar study to be able to follow enough kids and deal with attrition rates and all those kind of things, and there's just not the money to be able to do that. But I agree. I don't think we can say that absolutely positively health education is going to have a long-term impact because we haven't studied it. We can say that it has an impact for a year or 2 years on certain content areas, but that's all we know at this point.
Yeah, no, and thank you. That's again, I'm really trying to have a realistic approach to this. I see we have had someone join us who, Krista. Krista, if you wanted to click on your mic and say hello. We had a very small group when we started, and Krista, we ended up having a bit of an interview with Susan rather than a webinar per se. If you wanted to say hello, it would be great. Just click on your mic in the lower part of your screen, and we should be able to hear you. I'll give you a chance to do that while we move towards finishing up here. I'm just going to take over as presenter because I do want to go to one last slide, and which is really just presenting some the addresses that people can go to. The freshpartners.org, fresh-partners.org is the working group is on the first link, and the second is the webinars page. And if you're looking for more information, please contact me at that email address. So I'm Susan, I'm really pleased that we've had a chance to have a good conversation about this, a good interview. As I said before, we'll be using this, your insights in the writing of our report. And I was just trying to figure out how we're going to, we have 50 or 60 people on our working group. Getting those 50 or 60 people to a one meeting is just not possible given their busy schedules, but we are going to have 1 or 2 meetings when we pull this all together. And so our conversation today and your slides and your presentation will help us write this particular section of the report, and then we'll be seeking advice, their reaction to it as we move forward. So I'm really pleased to have had the chance to talk to you today about this. And we'll continue to, if I may, continue to get back and forth with you by email about how we can start towards getting a reasonable understanding of the amount of instructional time available in high resource countries. I'm just not sure how we're going to be able to do that for low resource countries or for countries that are being affected by conflict or disasters. Obviously the instructional time available to those contexts is going to be quite remarkably different, and it's important that we start with context and their capacity to deliver. But again, just to finish up, I'll stop the recording, and then we can